Welcome back. Thanks for watching. Today, I'm going to show you a really cool way to access the adductors through a side lying position. So before we get started, I just wanted to show you the body cushion system that I've been using for 20 years. I absolutely love this system because of its versatility. So the typical body cushion system comes with a leg bolster and these two pieces here, which Velcro together, and a headrest. So for today, I'm going to take the headrest and the leg bolster away temporarily. Make sure there's enough of a space in between these two cushions for the shoulder. Pull it up towards the head of the table, and then I'll be right back to show you how to set up the rest of the cushions for your client's sideline, and then we'll access those adductors. And now I'm back. My client is on her side. When you first get your client side lying, I always like to do this palpation here all around the hip to get my bearings, get my bony landmarks, and also to just, it feels good, and I'm also kind of just assessing and seeing what's going on. So now to drape, now that I know her greater trochanter is right here, I'm going to go straight down and take a little bit of sheet here. I'm going to tuck it right underneath her opposite hip. Then I'm going to take and hold that tuck with one hand, and then bring this draping up as high as I can. And then I'm going to tuck underneath that cushion on the opposite side. So now I have a nice clean line here for working on the medial side of the leg. I can start with some general warming, just entering down at the ankle and taking some nice broad effleurage strokes. I can even do some petrissage, ringing petrissage. And again, during these nice warming strokes, I'm also assessing the tissue. So I am feeling some tightness. I'm going to wait until after my warming to go and search with more small tools. So here I like to just apply some nice pressure right onto the heel to stabilize this leg, while I'm then applying even more firm pressure along my heel of my hand, my right hand, as it glides up the medial head of the gastrocs, the medial side of the gastrocs. And then up here, riding over this area of insertion for the adductors. And now here again, I'm going to work these muscles. Instead of pressing into them, I'm just going to kind of gently pull these muscles away from the bone with a squeeze and a lift. Pressure's just matching the tension in the muscle, matching the tension between my thumb and my forefinger. And I'm going to be careful not to go too much higher. And then I feel some tightness right in through here. And if your draping does happen to start sliding, just readjust as necessary. And then you can take it in here with some more fine tools, smaller tools, and start searching for those areas of tension, tight bands, tender points, trigger points, all of which feel and have a different consistency and texture than normal muscle tissue. And I'm going to check in with my client and make sure that my pressure is perfect. I'd like it to be a comfortably deep pressure. So how is my pressure, Kirsten? Good. Thumbs up. If you couldn't see that, she gave me a thumbs up. That's what I like. So I've also asked her to let me know if at any time my pressure is too much or not enough, so that I can adjust accordingly. But here you can see this angle is just perfect to access these adductors. And then the further back I go, of course, now we're getting into some hamstrings. And then we can come back down here and give some more detail work on the gastrocs and even perhaps a little bit of soleus. And the nice thing again here is you can take and put a bend in the leg. You feeling a little stretch?
Mm-hmm.
In the right hip? Okay. She's giving me an affirmative. And I'm just slowly bringing her leg down towards the table. And I can stabilize it with my right hand, and now my left hand is stroking up this outside of her leg. And I can even take the femur and slowly start bringing the femur back to give her a little bit of a psoas stretch here and a quad stretch here in the front. The more I bend her knee, the more of a quad stretch I'm giving her. The more I take and bring her femur back, the more of a psoas stretch she will feel. Are you feeling a good stretch in the psoas?
Mm-hmm.
Okay. And then again, back to the feet. We are at the perfect angle down here to just really use the table and press into the bottom of the feet. And the ankle for that matter, working that medial malleolus. And then this is a nice way to finish after you've done your work. And I can roll her leg even further into external rotation this way.